Hi there. Thank you so much for joining me again for this episode of Monday Moments. If we haven't had the opportunity to meet, my name is Ananya Datta, and I am the founder and CEO of Impact Clinical Strategy Consultants, a firm helping EDs and urgent cares improve operations. On today's episode, we're going to talk about the 5 ways that we can safeguard the mental and physical burnout of our clinical staff. So, number 1, we can commit to a better staffing and safe patient ratios, not only for nurses, but also for providers. As the volumes have fluctuated this year from COVID, and as we await the second wave this fall, it is extremely important to safeguard that, not only for the patient's well being, but that of your clinical staff. Number 2, reducing the risk of transmission to frontline workers. These are lessons that we have absolutely learned from the early stages of COVID in 2020. Having enough PPEs ready to go, having vendors who can fulfill these orders, as well as providing these protective equipment to our frontline workers provides the reassurance that we did not have before in terms of risk of transmission for COVID. Number 3, providing fair and equitable paid time off for clinicians who have been exposed to COVID or illnesses during this time. If we're expecting frontline workers to be at the forefront of COVID, especially with the challenges that we face with lack of PPEs in the prior months, it is extremely important to treat them fairly, that if they do get exposed, that proper time off is given to them. Number 4, providing access to therapy for individual as well as family therapy for your clinical staff. Now more than ever, they're looking to you for leadership as well as grace and compassion in order to move forward with the challenges that they're facing in their family as well as on the front line with COVID. It is your responsibility as a healthcare organizations to be responsible for the mental health and the resilience of your clinical staff. And that is one actionable way to achieve that. And number 5, we've come across this before, but compassion and grace. This cannot be reiterated enough. Everyone is facing so many challenges, whether it's at home or at work, whether it is virtual homeschooling for many parents, many cut hours, people are furloughed. Your clinical staff has undergone so many changes, and extending that grace and compassion not only to them, but also your other staff, whether it's housekeeping or otherwise, really shows a role model of care as well as the core values that you as an organization are upholding. I hope that was helpful. Thank you for joining me on this episode of Monday Moments, and I will look for you on the next episode. Take care.